Surgical procedures across the world continue to rise, and it makes sense if you think about it. Most populations are getting older and older, and as we get older, we need more surgical procedures. And we're faced with more and more challenges, not only in how do we manage patients, but in how do we manage all of the other things that happen in the operating room as well. The operating room is also not all that safe for the workers in the operating room. Respiratory compromise, in my opinion, is now one of those things that we've ignored for year after year after year. And while there have been special groups scattered throughout the world who have taken them very seriously and spent a lot of time looking at it, overall, as a healthcare group of providers, we've ignored it. I'd really like to look at the hazards of respiratory in the operating room based on surgical smoke, and a couple of other things that really are purely respiratory based. What it means for you as a healthcare worker, what it means for the patient who is now completely at your disposal, what's being done, what we can do, where we need to go in the future with research, and maybe hopefully at the end a little bit of a common sense approach to the problem. This is US data only. And it was estimated, this is 2 years ago, that there were 500,000 OR personnel who were exposed every year to significant amounts of surgical smoke. And most of them were multiple hours a day, 5 days a week, 52 weeks a year, and multiple years, over and over and over. The same exposure. Well, why do we have surgical smoke beyond we have surgical smoke? What is it really? How is it created? Why is it there? If you think of all of the cells in your body, every cell that you have is made up of a tissue protein. One type of a protein or the other, or a mixture of all of those. In order to do our job in the operating room as a surgeon, you're there to destroy tissue, whether you like it or not. It's just a fact. You have to make an incision to get where you're going. To make that incision, you have to destroy tissue. Electric cautery, tipped or not tipped, point tips, sharp tips. We could go on and on with the type of electric cautery, cut modes, coag modes, but all of them generate a heat that separates the tissue. And when it separates the tissue, it destroys those cells. When it destroys those cells, it vaporizes those proteins, and those proteins turn into things that we didn't want to talk about in the past. We use it to stop bleeding for the same reason. If you can add heat to the end of a vessel that's open, it curls up on itself and the bleeding magically stops. Really good for the patient, maybe not so really good for the healthcare worker in the operating room. And the same thing happens whether you're using heat or light, whether you're using electric cautery or whether we're using lasers.